Good afternoon. I am Freddie Blondet. It's a pleasure for me to be here presenting this poster titled Evaluating Upstream Social Determinants of Herd among a Key Sensitive Population, Survey Refinement, and Formative Research. So although you see the whole screen, I will remove me. So we can start explaining the purpose of our work, which was to improve and adapt existing survey to make it more specific to capture more volume of data from the Hispanic community in Scranton. All this in hopes to evaluate social determinants of herd among them. On the other hand, the feasibility that this survey could be adapted and modified to different communities is a great opportunity to exploit to start discovering the needs of different underrepresented communities in Scranton and other areas. Also, the possibility of a continued improvement of the tool after each data collection is unique and help us to each year be updated about what is necessary to be improved in the survey and also to know what are the needs of the communities around us. To do all this possible, we are working closely with the Center of Excellence of Geisinger Commonwealth School of Medicine because our ultimate goal is to promote more equitable access to healthcare for underrepresented groups as are the Hispanic community in Scranton, which are representing right now the 14.9% of the population in the city. The methods used to conduct this research consisted of an adapted survey, which was made on a consensus basis. The analysis of the data was done with a focus on internal consistency and the reason for not completion of the brief assessment. We used the software Quartz for the data analysis, and this exercise was presented by the Geisinger Institutional Review Board. On the survey, we measure 5 areas that are community living and quality life, health and safety, economics and basic services, education, and employment. In total, we approached 113 people, 67 of which fully completed the survey and 46 only partially. Most of the unanswered questions were related to age, education, doctor access, time living in US, residency, quality of life, place of birth of the parents, and the data extracted from the survey show the follow social determinants of herd present on this community. There are discrimination because 32% of the participants have experienced discrimination for being Hispanic. Unemployment because 29% of the participants have faced unemployment. Poverty because 51% of the household income of the participants with 3 to 6 members make less than $25K a year. Low education attainment because 54% of the participants only have a high school diploma or less education degree because a great percent of them or not study at all or just finish primary. No access to health care because 32% of the participants don't have access to primary care, 30% of them don't have access to a specialist at all, and there has been situations in which 25% of the participants need prescriptions, but they never get it. Also, 30% of them don't have access to dentists. This data show that living experiences of our participants are less than ideal and could pave the way to the maintenance of health care disparities. Also, from the data, you can also saw that the lack of education could be the principal social determinant that is maintaining the disparities in these communities. Some factors that might have affected completeness of the survey with the length of the survey, high number of questions, sensitive information. Also, the logical sequence of the question could be refined and tailored to the Hispanic community. Our work is important because using these surveys, we can zoom in on specific populations to get a better look at what is affecting their health with time. As we improve our survey and population participation, we can get a better sense of what is impacting our local community. These efforts will allow us to plan interventions in specific communities and allocate resources where they are needed the most. By understanding what affects the health of underrepresented populations, we can begin to understand the gaps that exist in health care, identify their causes, and propose adequate solutions. Some of the limitations of this project include few surveys were completed, a small sample size, the sample is limited to Scranton City, and the Spanish language version could be refined. Our work is not over yet. There is still a lot of work to be done, and we are dedicated to putting our best efforts to do right by our community. We are currently working on bettering the survey by improving the sequence order of the questions, combining and rewriting questions, and also brainstorming on ways to increase our sample size, between other aspects. Thank you very much. I hope that you enjoyed this presentation.